Hello.
How y'all doing?
We're here tonight talking about our wonderful sister,
Oh Lord.
Dr. Tawana Coates. She's on the spotlight. She doesn't like it.
No.
But last time we had our conversation, we talked about my summer, how it went.
Mhm.
We're going to be spending some time talking about her summer and what she's doing because she's doing amazing work
Oh,
in
thank
her
you,
personal
sis.
life and her professional life. So, you ready to get
Let's
to
do
it?
it. Let's
All
do it.
right.
It's only right. We did it with you, right?
Exactly.
It's
Exactly.
easy talking about her.
I know. And it's going to be easy talking about you
Sure,
on
sure.
my end.
Okay, you're so
Okay.
sweet.
So now we know that you are from Kansas City.
Yes.
You came to Kentucky to do
Mm-hmm.
your training.
Mm-hmm.
You had 4 hard, long years,
Yes, ma'am.
right? You felt like it
Yes.
was never going to end.
Yes. And for all the residents out there, shout out to y'all. Yes.
Yeah, exactly. We understand. Um, Now that you are an attending
Mhm,
out there in practice, tell us a little bit about your day,
mhm,
how your life is now, and why you chose private practice versus
mhm.
academic practice.
I'm gonna start with the latter part of the questions. The private versus academic for me was a very difficult decision just because I love to teach. I think I told people I wanted to be a teacher ever way before I ever said doctor. And
Mm,
so I love to teach. I love the research part of medicine as far as like learning different things about cultures and why we do certain things. And so the academics part versus private was really, really difficult. But one of the things that is different and for me was I really, really wanted to go out and practice and learn my own way
mhm.
because sometimes I felt like if I chose an academic institution, it would be the institution I trained at, which I loved, that I would probably get accustomed to their way of doing things versus finding my own way and my own path and my own independence. But I still get to teach. So even though I'm doing private practice, I am still able to have medical students. So I have
Good.
medical students that are third and fourth year medical students that come in and they shadow me. I show them how to do deliveries. I show them suturing and knot tying. I still get those things, but I get to choose when I have it
Yes,
versus you have it all the
all the
time.
time.
So I get to choose like, this is not a good month. So that made it a little bit different.
That's so nice. And so it
Mhm.
sounds like you wanted to have time to grow and
I
develop as a
did.
young
I
doctor.
did. And like, I feel like in academics, you learn so much and all the
Mhm.
things you can do. And so it was really important for me to find my independence of like how I want it to be versus sometimes in academics, which is amazing, you can kind of follow culturally things to do.
Mhm.
And I just was like, I just want to kind of get out and like spread my wings and see what type of doctor I want to be,
I
you
like
know?
that.
So
Okay.
I know it's been a journey. It's a
And you're
journey.
so happy.
I love it. Now,
Yes.
it comes with its faults, right? Like there's
Yes.
nothing that is perfect. But I definitely feel like I'm where I am supposed to be.
Good.
But private practice, the business of medicine, it's just a different feel.
Mm.
And I miss the camaraderie, like, being able to come to grand rounds is different. So grand rounds is something where you go to and have a dedicated time for learning in medicine. So I'm doing that on top of seeing patients a day, instead of having dedicated time, being able to really have that camaraderie with your learners all day. So having residents keep you fresh, keep you young because they're like, why are we doing this? I don't have people questioning me all
Right.
day. So I feel like I miss that like banter a
Okay.
lot. So I definitely think that that's part of the things that I'm missing for sure. Yeah.
Yeah. Well,
Yeah.
that's great.
Yeah.
So now tell us about your day then.
Yes. So one of the things I love is how different every day can be. So I spend some days in the operating room, I spend some days in the office, but at any moment of time, I could be stopped and I could be delivering patients. So a day in the office for me can be anywhere from 8 a.m. to 4 p.m. But anytime throughout the day, if I have a patient who is
Mhm.
in labor, I am managing labor and delivery during that time period as well. I also have dedicated OR days once a week. And so I do surgery for women who are having concerns with bleeding, having concerns with pelvic pain. Also, surgery for women who want to get pregnant, or some women who have lost their pregnancies and had a miscarriage. So I get to do that full scope gynecology surgery, which comes with its own tasks as well. I also do call days, so I spend about 24 hours on call at a time. So where I specifically take care of women in the hospital as they are in early labor or delivering. So full scope, very tiring, but
Yes.
I wouldn't change it.
Very
Yes,
rewarding.
it is rewarding.
Okay,
Yes.
so now, all the training you did,
Yes.
all the sacrifices you have made,
Yes, ma'am.
your family has sacrificed as well.
This is true.
People
Yeah.
don't realize that, your
That's true.
family is sacrificing along the way.
Yeah.
So now, out as a doc in private practice,
Mhm.
no more training, you're the
Yes.
boss.
Yes.
How was this summer for you? How are
Yes.
you living your summers now because you've
That's a good
delayed
point.
gratification for so long?
I know.
Hi, we are so happy you came to join us today. Like, subscribe, send us some messages, let us know what you want to hear about. Thank you.
That's a good question. I know, because before, being an attending, July 1 is when everyone is starting as a new doctor in residency. So this last 2 years have been different for me. But this summer, we kind of did things a little bit differently, just because we just moved. So we are settled into our practice now, and we will move closer to our practice. So we spent some of our time this summer moving into our new home. And then we also did some traveling. So we do this thing where we invite our nieces and nephews with us. And so we had a family group vacation. So
Very good. Well, first of all, congratulations on the new home.
thank you.
It's beautiful. You deserve
Thank
every
you,
bit of
sis.
it.
Yes,
All that
thank
hard
you.
work.
I appreciate it.
So now, so over the summertime,
Mhm.
you said you had some vacation time?
Yes, yes.
Because every time we try to get together,
I know.
you out of town. So
She
I'm
need to
like,
stop it. She be outside too, y'all. She be outside too. Her husband and her family, they be outside.
you be outside in another state though. So you all have done a lot of traveling, which is so
Yes.
wonderful and such a reward to be able to
Yeah.
do that with your family. You all have sacrificed so
Mhm.
much. So what has been the best summer trip or vacation y'all have had?
Oh, okay. I have two of them for this
Okay.
year. So one of the big ones is kind of the entry to summer. We did a bigger vacation with our nieces and our nephews and our cousins and our siblings. And this was a trip where we went to the Dominican Republic, and we wanted to kind of just treat some of our family members that
Yeah.
those are really close to us, because medicine is something that takes away from us all the time. And so this was a nice trip to bring my closest family members together and just have a good time and celebrate life together.
Yeah.
And we don't do that often, because unfortunately sometimes we only get together when we're mourning something,
That is
when
the
there's a
truth.
funeral and we're celebrating the end of life. And so I really wanted to do something where we're celebrating life. So that's one vacation
That's
that
beautiful.
was kind of entering into the summer. But the biggest one is always our summer trip with our nieces and nephews. And actually, my husband's sister started this. So he has a sister who has no kids, and she likes to get all the nieces and nephews together. So we did a summer vacation where all the kids come together. Ages range from 4 years old up to 18.
Wow.
And there's 10 to 12 kids, and we
Mhm.
bring them all together and we do activities together. And some of that is just activities in the house. So nothing that's very expensive at all, but
Okay.
whether that's movie nights and game nights and just different artwork things or talent shows, wherever it is, just because these kids have a lot of character.
Yes.
So after that vacation, I'll be needing a vacation after the vacation. But it's one of my favorite things is our child is the only child. And so it's really nice to have her have those connections with her family, with her cousins. And it was really special this past year. It truly was, cuz even though they got a little bit on my nerves, I know it's hard. It was really good. It was a fun time, and just to kind of learn about seeing how their personalities change over a year in the summer, that was really nice.
That
Yeah.
is so wonderful. That
Yes.
sounds beautiful.
It was good.
Now, was this trip everybody came from different places to one place, or did you
Yes.
all travel where the
No,
most of the family was?
usually we go somewhere else.
Okay.
So this year, since we had just purchased our home, and when they come to Louisville or to the Kentucky area, we're always leaving. So this trip, we actually stayed and did things nearby locally
Nice.
because we never had a chance to do that. They always come here for a minute and then we go elsewhere where we're going to travel to. So that was nice.
Well, very good.
Yeah, so they got to like break in the new house, and they also got to we got to explore the local like shops and like swimming pools and just all the things.
So fun.
They didn't kick us out of our neighborhood, so we good. We good.
Awesome. That was the first test.
It was. I was like, go ahead and break the house in. Go ahead. You know. So
I know I'm coming off mic for this one.
Yes.
And I'm jumping in.
Yes.
I'm sorry. T, you've been over to the new house, right?
Oh God.
I spent the night, baby.
Okay. I just wanted to be sure. I love it. I've been there before. Is it nice?
It's very nice. It's beautiful, honey. They did a great job.
Teasing me. Listen, for all my family and friends who is local, y'all know I love y'all. We gonna have something soon.
Yes.
Very soon.
Be patient.
I gotta get it ready for y'all. See, this, you know, she a real one. She came when I didn't have a couch.
Nope. Aero bed.
Right. Oh.
Okay, so now being in private practice, you know, you have your own set of patients that you are responsible for. They look at you, they count on you. How do you manage private practice and finding time to get away with your family and enjoy yourself and not be on call 100% of the time?
That's really, really tough. I've struggled we talk about the glitz and glam of private practice of being able to create your own schedule. But I've struggled internally a lot with it because I like to give myself so much to people. And like, I don't want to put a burden on my partners. And it's not that they make me feel that way. I think internally, that's just the pressure I put on myself. So it has been a lot of like just kind of turning my phone off, doing what I can in the moment. So being present in the moment when I can with my patients, but being okay to let go when I'm away. And it's also, a lot of it is how my office is set up too, which is really nice. We have amazing nurse practitioners and nurses and just our staff who help things function and get things going, even in my absence. But I think that my first year or two, I fell short because I didn't know how to disconnect, or I felt like I didn't know how to utilize my resources. And that is a learning pain that I definitely had. So it has definitely not been perfect. But I'm just striving to be better every day because like you got to have that balance. If not, you get burnt out. And I've seen a lot of people just even with, you know, the pandemic and COVID and just life, we just overdo and we get burnt out. So I'm trying to find those disconnections. You know, I think for me, really, to be honest, is like, this platform here has been a really good way for me to kind of disconnect a little bit because I can come here, I can like chat with you and like kind of let loose. We talk about life, but we also can connect with people in different ways outside of an exam room. And it just humanizes us both in a different way. So that has been really great for me too in this past year.
That's so nice.
Absolutely.
Well, we're going to talk a little bit more about everything, but I think I would like to shift a little bit to the professional side. And I know that we've had many conversations about your patient population. Tell us about your patient population, what kind of patients you have been interacting with, and how you've been building your practice in different directions based on the patient population.
Yes, absolutely. I think, you know, as an African-American provider, I wanted to be in a diverse patient population just because even for me, when I was looking for providers, I wanted to find someone who looks like me or I can connect with, even if they weren't my doctor, just to kind of, I feel like it made me feel a little bit more safe to be able to ask questions. And so coming into a community, I wanted to make sure that I am serving a community of women or even transgender men that look like me, and also that comes from different walks of life, regardless of what that be, whatever their backgrounds is, whatever their income levels are. Just because, like, even though people see me now as a doctor, that is not the level that I've always been. That is not the family I came from. I'm first generation at college graduate, as well as medical student, as well as doctor. So I wanted to serve people of all backgrounds. So for now, I have very diverse patient population. I am never going to be the doctor that stops seeing Medicaid patients. That is not my life. Could I choose to do that as a private practice doctor? I could easily. I'm never going to do that. We appreciate you all for watching our episodes. Please like, follow and subscribe to our channel so that we can bring you more amazing content.
Okay, so we talked so much about your personal time. We're heading into talking about your professional time. You've already said a few things. Now, my question is, how has your workload changed during the summer and managing your summertime? And what are you focusing on professionally in your work as a doctor during summer?
Yes. So workload for me has changed because I do have a lot more gynecologic surgeries that are occurring in the summer. And mostly because women have that time period off where their children are not in school. And so this is a good time for women to change or schedule their surgeries. So I do a lot of robotic surgeries during this time. So I do robotic hysterectomies, myomectomies. I even do some endometriosis surgeries. So I'm busy in that standpoint where I am getting more robotic surgeries in or gynecologic surgeries in general, which has been different because I feel like it goes in waves. Summer months and again for the fall because people want to get their surgeries in before insurance and things changes. So this has been a busy time in that aspect. Professionally, things have changed because I have started saying no to a lot of things, which
That's
you may be
good.
surprised because I used to be a yes woman for everything, but I am learning that when I say yes for things, I'm saying no to my family. And so I have been really particular about the things I sign up for or the organizations that I'm involved in or how I'm involved. And so I've been dedicated a lot of my time to more care focused on GYN specific conditions. I feel like we spend a lot of our trainings focused on obstetric conditions. So I am currently looking at and doing conferences that are virtual, as well as some getting ready for the fall that are more GYN specific conference when it comes to menopause care, hormone replacement therapy, and just learning to continue to improve my surgical skills. I feel like, for robotic or laparoscopic surgeries, you always want to get better and better. There's always different techniques to improve on, such as learning different like radioactive ablation therapy for like fibroid surgery, things like that I'm transitioning into. So I've kind of tweaked how I've kind of went into professional organizations because I want to make sure that I am still learning and feeding myself too. And so that's kind of changed how I've kind of interacted. Yeah.
Well, that's so
So it's been
great.
busy.
Yes.
Yes, it has.
Busy summers
It has.
now, heading back into the fall.
Yes.
Thank you all for taking the time to listen to
Yes.
Dr.
Yes.
Coates' career and how
Thank
it's
you.
evolving and how much fun she's having in the summertime. We want you all to like, subscribe, follow us, send us messages, and let us know what you want to hear.
Yes. And thank you so much, sis, for coming and talk with me. I get a little nervous sometimes talking about myself, but it was so nice to debrief and just chat with you about kind of our life. Because a lot of things I'm talking about, she's doing it too. So it was nice to chat with you.
Thank you.
See y'all soon.
All right. Bye.
Bye.